Good morning to everyone. So here I'm going to present about the detecting Parkinson disease as an early stage through machine learning algorithms in brain MRI images. Our paper ID is ISDA 118 and I'm Snehalatha, professor from Biomedical Engineering Department, SRM Institute of Science and Technology. So let me give a brief introduction about the Parkinson disease. Parkinson disease is a kind of a brain disorder. So the person affected with Parkinson disease will have uncontrollable movements. They have stiffness, and their balance and coordination will be very difficult. And particularly the nerve cells which is present in the brain, which is very much affected due to this Parkinson disease, due to the release of neurotransmitters called dopamine. And due to this Parkinson disease, the patient will have uncontrollable movements, and the symptoms will be the patient, as the disease progress, the patient will find difficulty in walking and talking, and they have some behavioral changes like sleep problems, depressions, memory difficulties, etc. And there are so many modalities to diagnose this Parkinson disease like computer tomography, MRI, PET, CT, SPECT, etc. So here we have focused on magnetic resonance imaging technology, which is a non-invasive technology to diagnose this Parkinson disease. So if you see the stages of the Parkinson disease, at initial stage, the patient will have develop mild symptoms, and it is they can able to run their daily life. But in stage 2, if you see, the symptoms gradually develops. So the patient will have tremors in the muscles and stiffness, and the patient's posture will be uh, very poor, and they have trouble in walking. And in the third stage, the movement will begins to slow, and they lost the balance. And in the fourth stage, if you see, the symptoms will be very severe, and without any device, assisting device, they cannot able to walk at all. And the later stage, it is very difficult for them to run a normal life, so they have to sit in a wheelchair and lead their life. So that is the condition of the Parkinson stages of the disease. So our aim is to develop an automated system for classification of Parkinson disease normal in brain MRI images using machine learning algorithms. So our objective is first to segment the brain region using the skull stripping algorithm and to extract the statistical features using gray level co-occurrence matrix, and to develop an automated system for classifying the Parkinson normal using machine learning classifiers. So this is the overall methodology of our proposed work. So first we have collected the data from the SRM Medical College and Hospital Research Center. So we have collected the MRI images for about 16 Parkinson patient and 16 normal, and we have pre-processed images and finally segmented using a skull stripping algorithm, and we have extracted the features from it. We have extracted the statistical and the shape features such as brain symmetry, brain pore distribution, and brain curves count. And finally, we have classified using three different classifiers such as support vector missions, Navy's Bayes, and K nearest neighbor algorithm. And this is a picture of the um, image, MRI image, in which the first one represents the Parkinson's brain image. So here a mask is applied over this image. Using the skull stripping algorithm, we have extracted the inner cortical areas of the brain, and the lower regions, that is lower one, that is the figure E, represents a normal image in which the mask is applied, in which we are able to extract the inner cortical areas of the brain. So this picture shows the original Parkinson image and the skull stripped image. So we can able to see the difference between the Parkinson's image and the normal. So in the Parkinson image, we can able to see that there is a shrinkage in the brain areas in the Parkinson disease, whereas in the normal brain, we can able to see, we cannot see such a kind of a shrinkage here. And the table 1 represents a feature which is extracted from the Parkinson's and normal brain. So among the features extracted, we found that the mean and entropy value is very less compared to very less in Parkinson's brain compared to normal brain. So why? Because the reason is, since the brain area has shrunken, the mean intensity values which is present in the image, it is less in Parkinson's brain compared to the normal brain. And when you see the table 2, it represents the performance metrics of the Parkinson's disease using machine learning classifiers. We have used three different classifiers like SPM, Navies Bayes, and KNN. Among that, SPM outperformed well compared to the other two classifiers in terms of accuracy, sensitivity, specificity, precision, recall, and F1 score. So if you see, the accuracy is around 98.3% in case of SVM compared to the other different classifiers. Similarly, we have the recall and F1 score as 100% and 98.3% respectively compared to other two classifiers. And the figure 3 represents the ROC curve for the SVM classifiers. Usually the ROC curve is plotted for a true positive rate versus the false positive rate. So here we can able to see that when the curve reaches the unity value, so we can say that the classifier perfectly classifies the group, the normal and the Parkinson groups. So here we have obtained the area under the curve value as 1. So which indicates that the classifiers perfectly classify the two groups, normal and Parkinson disease, in an effective way. So finally, to conclude, the Parkinson's brain image exhibited higher covariance, variance, and standard deviation compared to the normal brain images, but there is a 13% increase in mean and 9.4% increase in entropy values compared to the normal brain images. So, which indicates there is a textural difference exists between the Parkinson's and the normal brain images. So, and in the among the three different classifiers used, SPM classifier outperformed in terms of accuracy, precision, and sensitivity compared to the other two classifiers. So, this study proposed a system. It utilized distinct features to accurately classify the Parkinson's brain atrophy in MRI images. So, these are the references. Thank you.